Hello everyone, thank you for tuning in today. In this video, you will learn neuroanatomy, neurophysiology, and behavior. In this video, I will go over neurobiology, nervous system organization, brain anatomy like lobes, cortex, limbic system, brain stem, cerebrum, neurophysiology, neurotransmitters, neurotransmitter imbalances, neuroimaging, genomics, population genomics, pharmacogenomics, case examples and takeaways. Neurobiology. Understanding brain structure and function is essential for psychiatric nurse practitioner. Neurobiology information assessment, diagnosis, and treatment of a psychiatric disorder is essential. Advancing in neuroscience reduces stigma and improves care. Central nervous system organization. Central nervous system include brain, spinal cord, and peripheral nervous system. Peripheral nervous system include somatic, which is voluntary, and autonomic, which is involuntary systems. Autonomic system include sympathetic, which is fight and flight, and it works when you are awake and scared. Paranemic system works when you are asleep, and it works in your digestive system. That's why it's called resting and digestion. Neurons and synaptic transmission. Neurons transmit impulses by axon and receive impulses by dendroids. Synapse is a conjunction where neurotransmitters relay signals between neurons. There is a two action potential phases. Depolarization is when sodium and calcium enter the cell. Redepolarization is when potassium leaves the cell. Brain anatomy. Brain anatomy includes frontal lobe, temporal lobe, parietal lobe, occipital lobe, limbic system, and basal ganglia. Frontal lobe is the executive function, controls executive function. Motor control, there is a speech center in there. It controls personality. Sometimes you will see patients and their personality change. The family and friends of the patient will tell you, this person was not like this before. That means there is a damage happened to that area, whether to be trauma or stroke. Temporal lobe controls auditory processing, memory, emotion, and there is a language center in the temporal lobe. Parietal lobe is a sensory integration center. Taste, when you eat something or taste something, your tongue or your mouth signals to that area, to the parietal lobe. It also controls the reading and writing understanding, or the comprehension. Occipital lobe is the visual processing center. You will see something and you will translate what it is. What are you seeing? That is where it happens. Limbic system is the emotional and memory center. It includes amygdala and hippocampus. Basal ganglia is the motor control, movement, integration, and regulation, affected by the psychotropic medications. Brain stem and cerebrum. Dopamine synthesis area called ventral tegmental area is in the midbrain. Also, substantia nigra is the midbrain. Norepinephrine synthesis happens in the bones. Aerodynamic control of the heart rate, blood pressure, and respiratory happens medulla. Balance, coordination, and posture happens cerebrum. Formation and conscious alertness and reflexes happens reticula. Neurophysiology. Neurons and ganglia support brain function. Neurotransmitters released at the synaptic affect postsynaptic receptors, and synaptic dysfunction contributes to psychiatric symptoms. Neurotransmitters include monoamines, amino acids, cholinergics, neuropeptides. So monoamines include dopamine, norepinephrine, epinephrine, and serotonin. Amino acids include glutamate, which is a excitatory, GABA inhibitory, glycine, aspartate. Cholinergics include acetylcholine, which improves memory and attention. Neuropeptide include substance B, endorphins, and somatostatin. Neurotransmitter imbalances causes many different psychoses and psychiatric symptoms. For example, if the dopamine is increased, patient will have psychosis and other psychiatric symptoms. If the dopamine decreases, patient will have Parkinson and other psychiatric symptoms. If the serotonin decreases, patient will have depression and high anxiety. If the norepinephrine decreases, patient will have depression and anxiety, high anxiety. If the gabapentin is low, patient will have anxiety. If the glutamate is increased, patient will develop bipolar, seizure, and high activity of brain activity. If the acetylcholine is low, patient will have Parkinson's diseases and other symptoms. Neuroimaging are tools to assess brain function and structure. There is a different ones. There is a CT scan, there is a MRI, there is a EEG and MAG, there is a SPECT and BET, and there is a fMRI. So CT 3D assists the brain structure and limited to sensation. MRI details the soft tissue imaging and is better than the CT scan. EEG or MEG they assist the brain electric activity. PET or SPECT they assist functional and is imaging use. Their imaging is used to radio traceries. fMRI combines structural and functional assessment. Genomics and population genetics. Family inheritance helps assess the gene risks. Inheriting parents. Inheriting parents include autosomatic, dominant, recessive, X-linked, twin adoption. Study shows the high inheritance in psychiatric disorder, gene environment interaction influence the disease experience. So all this can affect the psychiatric disorder development. Environment can affect you. There is some of the psychiatric diseases that is inheritance or run in the family. Pharmacogenomics. Gene variation can affect drug metabolism. Example will be CYB450 enzymes. Thus, testing helps personalize medication choices and dosage. For example, before you prescribe carbamazepine to Asian population, you have to test them because carbamazepine can cause skin narcosis such as Stevens-Johnson syndrome. Key takeaways from our lecture include neurobiology is the fundamental for psychiatric nurse practitioner practice. Understanding brain structure and function helps diagnostic and treatment. Neurotransmitter imbalances underlie many psychiatric disorders. Genomics and imaging helps personalize care. Thank you for joining me today. I would love to see you in my next video. Take care.